health authorities have called for a 2-week suspension of vending activities along the Harare-Bindura highway to stop the spread of cholera, which has been recorded in Glendale. The outbreak has resulted in 104 confirmed cases, including 1 reported death. Among the confirmed cases, 93 individuals have been treated and discharged, while 8 patients are receiving care at Sunguvi Clinic. Vending has been identified as a spreader of the disease, and authorities say these activities need to be monitored to contain the spread.
These days, this mango era. People that are eating mangoes, fruits and so forth. So where there is a cholera issue and we have too many vendors who can be selling fruits and vegetables without proper water and clean water, there's going to be also a burden. But definitely with this, we've said no, can our vendors maybe be restricted for few 2 to 3 weeks, so that if people who are passing by along the Bindura road or this Glendale road can try to buy fruits and so forth that can be sold along the way, it should be stopped with immediate effect, so that we don't want it to spread. When people from Harare, they can pass by buying the fruits from Bindura, or from Bindura pass by to Harare. That's another way of spreading the disease. So if we try to close that, we're going to contain.
Well, our reporter was on the ground in Glendale yesterday, and he gives us the full picture.
Mazoe flowers. This is where it all started, and it's not that colorful. The numbers grew quickly, and among the initial victims is Ruserainzo's neighbor. Sadly, she succumbed to the disease. Cholera is mainly spread through human waste and contaminated water. Glendale has not been spared. The community uses shallow wells which are easily contaminated by fecal waste, washing from best sewer systems.
The absence of tap water has caused people to drill or to dig shallow wells in their homesteads. And also the absence of tap water has made it difficult for the sewer to flow, because people need to flush and then the sewer will flow to where it is supposed to be going. But because it's not flowing, it's remaining stagnant and it solidifies. The
other factor identified is that of sewer pipes running parallel with water pipes.
The sewer pipes and the water pipes are running parallel. So there are areas where they are broken at the same point, such that now they are communicating. So the sewer is now getting into the water pipe and the water is going into the sewer pipes, and therefore feeding raw sewer to the people who are downstream.
Officials will be focusing their efforts in providing clean water and enforcing law on vendors, hoping this will wipe out the disease before it spreads.
Especially the toilets, they are not properly sited, so we've agreed that they are going to site them where it is proper, that they don't mix where they get water and the toilets. So where there is a cholera issue and we have too many vendors who can be selling fruits and vegetables without proper water and clean water, there's going to be also a burden. But definitely with this, we've said no, can our vendors maybe be restricted for few 2 to 3 weeks.
Behind me is a cholera treatment camp currently housing 10 patients. The cholera cases here in Glendale are currently low, but there's no doubt that this could be a threat to other neighboring cities like Bindura and Harare. Now, the hope for now is that the government interventions and that of humanitarian parties will help contain this outbreak. For Zimpepers Television Network, I am Stachisiwe Gwaza in Glendale.
Konapo, ipapo, ba ZTN Prime, DSTV channel 294, the place to be.